know when Jesus says yes. We are in a health segment discussing vaginal prolapse, a serious condition affecting many women. So Dr. Laura Grebande Struder is live on the studio with Radio Voice of Naija. Welcome once again back.
Yeah, thank you. Thank you. Yes, we were talking about prolapse issues, and the pelvic health is, as I said, it can be everything. It's a whole spectrum of complaints in this pelvic area. And
hold on, Doctor.
Yes,
we
of
have
course.
a caller, please. Hello, caller.
Good morning.
Good morning, sir.
Yeah, first of all, I would like to thank the doctor for the good job he's doing. I know God will help to help our women in Africa.
Yes.
My question is, the topic is talking about this morning, very interesting. But I want to know if someone there can have the same problem, also fiber. If you have the two, how does it go about it?
If he has what?
A fiber.
A fibroid.
Yeah.
If she has a fibroid.
Yeah, and the same time have what he's talking about.
Oh, if she has fibroid and also have prolapse.
Yeah.
Then that's a dual one. So, Dr. Laura,
yeah,
the question is, what can be done?
what can be done? Yes, of course, with fibroids, if the uterus is very large because of these fibroids, you could wonder if you can remove the uterus. But even without a uterus, if you remove the uterus because of fibroids, even then a prolapse can exist. We call it a vaginal vault prolapse.
Wow.
So, a lot of patients think like when I give my uterus, when they take out my uterus, I will not get a prolapse anymore. But that's not true, because even the vaginal top, the vaginal vault, can come down, or the bladder, or the rectum, both can cause also a prolapse. But if people have complaints of the fibroids, usually, and there's a prolapse, there's a decision to remove the uterus. But if there are some fibroids with a prolapse, you can just support the prolapse and not do anything about the fibroids. So it depends on complaints, it depends on size, it depends on location of the fibroids, and the severeness of the prolapse, and all these matters in the end will make a decision if you put them all together. So only fibroids and a prolapse, it's still difficult to say what treatment would be best.
Wow. Really?
You can like 30 years ago, we took out, or we, the gynecologists, took out a lot of uterus.
Yeah. Yeah.
But now we are more inclined to keep the uterus in, because there is some support system with the uterus in. And now we have more operations to keep the uterus. For instance, there's an operation that has a way of sort of taping the uterus from inside to the backbone.
Really?
Really?
That's a possibility.
The doctors say I'm doing everything.
Yes, it's
really.
Or we do a sacrospinal fixation. That means that you have the cervix, which is the first part of the. If you look in the vagina, you can see the cervix.
Yeah.
And you can have support that and stitch that to a ligament, which is really
strong.
So you can take it up again.
Yeah,
so then you leave the uterus inside, but you support by some stitches, support the cervix to a ligament, which is strong.
Yeah.
Which is strong.
Wow.
And in that sense, the lady can keep the uterus.
Okay, good news.
So we are more into uterus saving than
the uterus removal.
Uterus operating. Yes. So
hooray!
we try to
Awesome.
because an operation, as you said, your sister,
Yes.
or losing her life with a fibroid operation, that's terrible.
Exactly.
Because that's a benign condition.
She just entered and she didn't come out of her life anymore.
No.
A healthy woman, she walked in by herself
Yes.
and never came out again.
No, and that's really horrible that happened. It can happen, but
I'm
the
sure the
chances are
doctor
so
made
low.
mistake in her life.
And so you always have to make
The doctor
good
made
decisions.
mistakes.
Yes.
Yes.
Mistake of operating without being sure what they want to do.
Yeah.
And in that sense, explaining the patient what the condition is and what you can do about it is very important. Don't make a decision as a doctor yourself. make together with the patient the decision in what treatment you should follow.
Now, before we sign off, I want to know pelvic exercise, like the Kegels pelvic exercise. Does it help to suppress prolapse?
It can help not to make it worse. So in that sense, it can help. It can help. But if the prolapse is already in a further stage, then it won't help anymore, and then usually it will progress even more. So in the beginning phase of prolapse, patients can try to do these Kegel exercises, sometimes in collaboration with a physiotherapist, pelvic floor physiotherapist, which are specialized physiotherapists on the pelvic floor. So they can give advice, they can see for themselves, they can make you show what the problem is, they can do biofeedback, they can do electrostimulation. So the physiotherapist can do a lot of things to help. But if that doesn't work anymore, you don't have to do it. It doesn't make any sense anymore. And then you should go visit a doctor to see what next solution there is.
Okay, I want you to project your face or your eyes now down to the rural woman who is having a prolapse and who does not have a physiotherapist to help, to assist, who doesn't have a gynecologist to help. How can she, what can be the first treatment for such a woman with a prolapse?
Yeah, maybe medical professions like a midwife, maybe in the rural area, if you don't have a doctor, maybe other people like a nurse can help with the pessary. If they learn how to place a pessary vaginally, that would be a solution in the rural area if you don't want to have an operation, to first see if a pessary helps to support the prolapse. So that could be some program which could start to learn the nurses in small hospital settings or clinics to learn how to use these pessaries and how to learn it to the patients to put pessaries in themselves and take them out again. Maybe that's an easy solution for quite a number of patients with prolapse. And of course it's not a solution for all patients with prolapse, but maybe a substantial group can benefit from simple pessary treatments given by them, midwives or nurses, medical professions, but not doctors if they're not in the area, to support and advise them on that. It could be something for Nigeria or other African countries.
Exactly. Because
it's so huge countries and it's difficult to have really specialist care for all patients. Yes.
Exactly. Can prolapse be prevented?
I don't think so. If you have all the risk factors taken into account, those are risk factors you're dealing with. You cannot prevent them. Like giving birth, you cannot prevent it. Or if you're having asthma and having a lot of coughing to do with pressure down. So in that sense you cannot prevent it. But if you have some beginning prolapse and you do the physiotherapy exercises, Kegel exercises, maybe you can prevent it to getting worse. That is correct, I think. So in that sense you can do something yourself. Yes.
Wow.
Well. Well.
So, what is your last intake regarding to this topic to the women who must have listened to us on this vaginal prolapse?
Yes. Well, it's a lot of female patients have this complaint. I'm working in the academic hospital. It is not really academic care because it's more. It's not a tertiary treatments you need for prolapse. All academic gynecologists and myself, we work at a sort of pelvic floor clinic, and it's also affiliated with the VU Medical Center and the AMC. And this is Bergman Vrouwenzorg, and we are situated at Buitenveldert, but there's also a new location coming up here in Zuidoost. And patients from Zuidoost with pelvic floor problems, they can visit this clinic. And it's starting off in October, so it will come up like a new location for patients with prolapse complaints. So people with prolapse complaints, if they go to the AMC, they will be referred directly to this clinic outside the AMC, because in the AMC itself, the gynecology department don't see new patients with prolapse anymore. We are all taking these patients out of the AMC in this clinic, which is a small AMC on this issue, but so that patients know, like in the AMC, we'll treat them with prolapse, but only the difficult cases, and the easy cases we treat outside the AMC. But that's more an insurance issue. It is insured, but the AMC, they only want the difficult academic cases. Yeah. So
you are from the pelvic
center?
Center, because I had a doctor that came from pelvic center the last time to talk on women incontinence.
Yes. Okay. And who was that? My colleague.
Yeah, your colleague.
Okay. Good.
Yeah.
Yeah. Yeah.
From the pelvic.
Rovers maybe.
Yeah.
Jan-Paul Rovers.
Yeah,
Rovers.
Rovers.
He was the doctor who came to talk on women incontinence.
Yes, yes.
So is prolapse associated with incontinence?
It is associated, definitely, yes. But sometimes it can have a, it's an loose, it's an